Honourable Ruth Dyson.
Mr Speaker, this is a TUI billboard. This bill is not about restructuring in the public health system. This bill is not about restructuring in the public health system, and the reason it's not about that is because National promised they wouldn't restructure. This is about an administrative shake-up. It's like the cuts in health services that every single week we have reported in the House, every single week, cuts to frontline health services, and the Minister says they're not cuts, they're changes. Well, tell the 3,000 older people in Otago and Southland, Mr Speaker, an area very familiar to your good self, 3,000 older New Zealanders, that their home support, which is no longer funded by Vote Health, that's not a cut, that's just a change. Well, change has been pretty awful for them. Mr Speaker, the other really interesting thing is the sort of expectation that the Minister built up. He didn't build up a lot in that speech, actually. I wasn't sure that he wasn't going to doze off part way through it. It wasn't a very lively presentation. But he did talk about the huge savings potential to be made in health. Huge dollars to be saved by more efficient use of our taxpayer dollar in the health system and all the things that we'd be able to buy with that saved money. Mr Speaker, I want to refer to a similar report that was presented to this House and to the public of New Zealand. They only fell for it once. It goes like this. It says savings made yearly by health reforms could provide an extra 10,000 to 20,000 coronary bypass operations or fix 500,000 children with glue ear. That was the then Health Minister, Bill Birch. Did we ever see any health savings in the 1990s? Did we see any New Zealander getting better access to more affordable public health services? What we saw in the 1990s and what we're seeing now are absolute cuts. In fact, I've got some very attractive cartoons and I'm happy to present the Minister of Health with a copy of one after. This is a cartoon from the National-led government in the 1990s, and it's got a surgeon with the face mask on, but instead of the mask it's a $100 bill, and it says, "Welcome to your regional health authority. Pop up onto the bed, take off your clothes, one of our accountants will attend to you shortly." That's the health system that the last National government foisted on New Zealand, and this is the health system that Tony Ryle now wants to force on New Zealand. Less access, lower services and more expensive. There's another very attractive cartoon, Mr Speaker. This is another one by Tom Scott, actually. He's probably going to charge me for flashing his cartoons around tonight. It says behind the scenes in a typical New Zealand hospital. It says scalpel, clamp, blood transfusion, can we afford it? Calculator. You remember when we had the so-called great health reforms of the 1990s? All we got was cash registers in our public hospitals. And New Zealanders didn't like it. They didn't think it was fair. They knew that they had paid their tax dollars week in, week out to get access to public health services, not to have to pay for them again when they walked in the door of the local public hospital. Mr Chairman, the Minister didn't actually refer much to the bill. It was a political rant from the start to the finish, dull though it may have been. But the bill actually does a couple of things. The first thing it does is to establish a Health Quality and Safety Commission. This is the second new bureaucracy we've had in just 18 months of this Minister. The National Health Board chewing up thousands of dollars, and we're not sure at all what it's doing at the moment other than replacing what the Ministry of Health used to do. So we're not quite sure what the Health Quality and Safety Commission is going to do. But I imagine that it will have appointees from the Minister. It'll be the Minister's hand-picked personnel that will be running the show, and they'll probably do the bidding of the people that are giving the Minister the key advice in the health sector. If the aim is to improve quality and safety in our health system in New Zealand, there would be no argument from this side. But it's not at all clear why a new body is needed to do that. Will it just be a new bureaucracy? Will it just chew up more of the precious health dollars that we're seeing taken away from our families and our communities? And will we see any improvement in health and quality and safety as a result? That's not at all clear. We have seen some outrageous financial claims from the Minister, and he made them again in his speech, even though the key part of this bill is to set up a new bureaucracy. The Minister was still claiming in his speech immediately prior to me taking the call that we would see $700 million saved over 5 years in the health system. Nowhere in this legislation is there any indication of exactly how that money will be saved. We have the idea of shared services. I'm not quite sure what stage the Establishment Board is up to now. We have a ministerial dictate. No longer are the DHBs going to be required to work together until they get agreement on a pathway forward. If the Minister is intolerant of any disagreement, then he will take the call. He will decide. So all our local democracy has gone out the window. If the people in Tairāwhiti are having a discussion with Mid-Central Health about how to provide better services locally, and the Minister decides that that's not what he wants to do, he can just step in and say, no, you've had enough discussion on this, I don't want you to collaborate in that sort of way, this is what you're going to do. That ministerial determination and dictate is something that we have not seen in New Zealand since the days of the Honourable Bill Birch and his retirement. And correct, thank you, Right Honourable Bill Birch. My apologies for incorrectly appropriating his title to him. His retirement was one of the best things, actually, that could have happened to the health system in New Zealand. Mr Speaker, it's not at all clear, the Minister didn't elucidate on it at all, how the new Health Quality and Safety Commission will fit in with the Health and Disability Commissioner. We've recently had a new appointment. The Minister of Health announced a new appointment to the Commissioner's position, but there's no relationship at all explained in this legislation. It is a big puzzle why we need a new bureaucracy when a large part of the work that's described in the legislation is already under the mandate of the Health and Disability Commissioner. The idea of resolution, of protection and learning is the driving force behind the Commission, and this just seems to be an absolute duplication of that. Mr Chairman, I thought that the Minister in his 10 minutes may well have had an opportunity to apologise to New Zealanders for the significant number of health cuts that they have had to endure to frontline services in the last little while. As I mentioned earlier, we've seen huge cuts in Otago and Southland, particularly to home support for older people. In South Canterbury, older persons' health cuts again have been rife, but we've also seen a significant reduction in the number of people who are being allowed to access the accident and emergency department at the Timaru Hospital. In Gisborne, we saw a program that worked particularly with people with mental illness and people who had been violent. A community-based program with extremely good results has been cut because of health funding cuts. We've seen mental health services in Nelson cut back, Mr Speaker. We had a 6-week period in Gisborne Hospital where the hospital decided to close their surgery, close their theatre to save money. So for 6 weeks, the people in the Tairāwhiti district had no access to surgery. Of course, that would save money. Actually, if you closed every hospital in the country, it would save a huge amount of money. It wouldn't do much to assist health outcomes for New Zealanders. In my own town of Christchurch, we have seen week after week older people being treated in a disgraceful way because of the health cuts that Tony Ryle has signed off. In Mid-Central, Palmerston North, Horowhenua, we're going through a consultation process now where one shift of the district nursing service, an entire 8 hours of service provision will be cut, and the ATNR beds at Levin Health Centre are under threat. Mr.